We really didn't notice anything, I think because we saw him every day until we were watching him play soccer when he was about in 7th grade.
That's when they took me to the pediatrician, and he recognized that I had hunch in my back, and he said that it could be kyphosis.
Scheuermann's kyphosis is a disorder where the spine is curved when looking at it from the side, more so than it should be, and his was progressive over a short period of time.
So I, started researching and finding, orthopedists in the area, and I started asking my friends of doctors. And the first one I went to was a surgeon a friend had taken her son to.
The orthopedic, I was with him for 2 years, and he said that it was progressing over the 2 years and that if I didn't get surgery, it would get worse.
The first surgeon, when he talked about the surgery, he brought in this model of the spine and the apparatus, the rods and screws, and I think it was just too quick for us to see that, just the mention of surgery and this is what we're going to put in your son. And I thought, the first mama bear reaction was, no, you're not. I started thinking, well, something this important, we should get a second opinion.
A friend of ours who was a doctor recommended Dr. Cronen and said he had worked with him before, and he recommended him personally.
So Forrest's a quiet kid, and he just kind of sat back and took everything in while his mom did a lot of the question asking, and just very quiet, humble little guy.
He not only talked to me and my husband and was directing information to us, he also, included Forrest and made sure that he understood and asked him if he had any questions. I just felt more comfortable with Dr. Cronen. He seemed more down to earth.
So I leave it all in the family's hands as far as when to consider something like that. So I give them a very generic explanation of what would need to be done and what we could do short of surgery, continue following it, see if it continues to progress. And some choose to keep watching it over time and see what happens, and the Fullers opted to go ahead and fix it and get it over with.
I mean, it was a little nerve-wracking, obviously. I mean, knowing that you have to have surgery and everything, but I mean, I wanted to get it done because I wanted to get it fixed.
One thing that I've never seen the look on my son's face was of fear. And just to see that and then send him off to the operating room.
He had a posterior spinal fusion over the majority of the curvature, and there's a very specific way that you pick the levels that you do for each individual curve.
He comes running out. I'll never forget. He's carrying these x-rays, and he's like, you got to see these, and he puts them up against the glass so you can see through them. And he's giving me an instant comparison, and he's really excited, and it was a really neat thing to see.
He did quite well in his post-op course, and at every follow-up he's done beyond what I would expect of him. So he's had a pretty uneventful, less than rocky post-op course.
And immediately I found that he looked more confident, of course, because he's standing up straighter, but he is more confident.
And I feel a lot taller. I feel like I can do more. I can do pretty much anything or as far as sports goes and lifting and everything.
I take away a little bit of something from every patient that I get to interact with, and I asked him what he was going to be when he grew up, and he said he wants to be either a police officer or a preacher. Try to make other people around him better than before he met him. So he's just a cool kid.